Support for Radio Friends comes from IT Como, offering computer and IT services for small businesses and residential clients. IT Como can set up remote work-at-home solutions and data security and backup systems and upgrade your company email to more modern platforms. IT Como can also help you get the most from your technology at home. Learn more at itcomo.com. Good morning and welcome to Radio Friends on Friday, October the 27th. We're going to talk about dentistry today. And we have two of the nicest dentists that you will ever meet, Dr. Phil Batson and Dr. Elizabeth ABE from Columbia Healthy Smiles. Pleasure to have both of you here.
Thanks for having us.
And since this is your last segment with us, we thought we might just talk a little bit about dentistry in general. The first thing I wanted to ask you was, why is it important to go to the dentist? A lot of people like to put off going to the dentist and they think it's really not important, but it is. Why?
It's just having that continued care, continued maintenance of your oral health. You know, it involves your teeth, of course, but it also involves your gums, your bone of your jaw. It can also be an opening gateway to look for systemic issues. You know, the mouth is the, gateway to the rest of the body. And so it's just a way to stay on top of your overall health as well as your oral health. And, if you're seeing your dentist twice a year, that's more than a lot of people see their primary care physician. Exactly. And so a lot of times dentists are the first line of healthcare for a lot of people.
That's what I was going to bring up. So many times you can find something in the mouth, and if it's found early enough, can be taken care of. My mother was diagnosed with leukoplegia from her dentist, and when he saw that, he said, "You need to go to the doctor about this right away." If she had not been going to the dentist, that could have gone on for quite a while. The other thing that's important, too, is just for a good, healthy smile, take care of your teeth. You want to try to keep your teeth. They're meant to be with you for the rest of your life.
True, yeah. We're not sharks. We get our one set after we lose our baby teeth. Yep.
Let's talk about the advancement in dentistry. It used to be when you're not old enough to remember this, but I am. I remember the first time I had a tooth filled. They didn't deaden it, and it was painful. Mm-hmm. That has all changed now, hasn't it?
Yes, definitely. Even from the types of, we even pre-numb before we give an injection or anesthetize, and even that's changed a bit too in terms of just comfort level of that portion of it.
I know. The first time I had a tooth filled, I was just a kid, and I remember I was in excruciating pain, and I didn't want to go back to the dentist anymore. I could hear that sound of that drill, and I could still remember the pain of it. But now, as you mentioned, Elizabeth, before you even get a shot to deaden the pain, to work on your mouth, you do a pre-numb so that you don't even feel the shot go in, which is really nice. And I'm such a baby that way that I have them pre-numb my gums whenever I have my teeth clean. Mm-hmm. And you're very good about that, too.
Yeah.
I just don't like to feel anything.
Exactly.
So those are some of the really big advancements in dentistry, taking the pain away. But what about the x-ray? It used to be the x-rays, you stuck that piece of plate in your mouth and they took the x-rays and then it had to be developed. That's all changed now, hasn't it?
All changed. Digital x-rays are, kind of the standard. They're faster, they're more accurate, there's less radiation involved with them. They're just excellent. And then, with other imaging, now a lot of offices have what we call cone beam technology.
What is that?
It's being able to do a 3D image of the jaw, and so you can look at the jaw and teeth in 3 dimensions. Really nice for planning for surgeries like implants or root canals. You can really map out all the anatomy. It's just a really neat and interesting technology. And it's also getting into, there's facial scanning coming down the path where you take
facial scanning
for diagnostics and to
okay,
really create a whole treatment plan.
What are you talking about here? Facial scanning.
Basically a scan that in a single scan you can then put together a 3D rendering of the face and jaw.
So is it a picture that's being taken of your face?
No, it's still a radiograph type image, but we call it a scan, and then it'll allow everything to stitch together, so you have a 3D image to really develop a comprehensive treatment plan from one scan, hopefully. And that's coming down. That's
not here yet.
Not quite yet. In some places.
Okay, so the advantage of that would be what for treating your teeth?
One scan, and it gives the clinician ability to look at everything and put together a full treatment plan from one scan.
You're looking at your entire mouth and your entire jaw. You see everything that's there.
Yeah.
That's amazing.
So some really cool stuff coming down the pipe.
Yeah. And anything else besides that, or is that pretty much right now?
Oh, there are lots of things that are always evolving. It's just, time and of course money.
Yeah. Yes, that's the big thing. But the important thing to keep in mind is, if you have not, and I've said this before, if you haven't been to the dentist for a while, and you're afraid, and there's nothing to be ashamed of, saying I'm just afraid. I don't want to feel the pain. It's important to just take that first step and make that dental appointment and go. And they will take care of you. There is no pain. I remember after my first experience with the dentist when I was just a kid, I didn't want to go back to the dentist anymore. And I used to I would argue and fight with my mom and dad. Like, no, you're going to the dentist. I don't want to go to the dentist. Then when I grew up, I stayed away from the dentist for a while, and that was detrimental. And finally, I went back about 45 years or so ago, and your dad took good care of me, and then passed the baton to you. So if you have concerns, you don't have to worry about going to the dentist. You're not going to feel any pain. They pre-numb you first, then give you that shot, which takes away the pain. And you just kind of lay back there and let them do whatever they want to do in your mouth. You're fine. Anything else you want to add there, Philip and Elizabeth?
I think you hit a lot of that on the head right there. Just, give that communication to your dentist and to the office. If you do have any anxiety or anything, let them know. Yeah. Be open with the communication. That just makes everything easier for everybody.
Right. Say, I'm afraid I don't want to have any pain. She'll say, don't worry about it. We'll take the pain away.
Absolutely.
Give you a knock across the side of the head, too. No, they don't do that. No. But I guarantee you won't feel any pain. If you have any questions, the phone number is?
573-875-7071.
Okay, Columbia Healthy Smile. Guys, thank you so much for coming by. Thank you for being a part of Radio Friends and guest and supporting us. We appreciate it. Have yourself a nice day. Bye-bye.